Cardiology is pretty simple. There are only three things, and only three things that we deal with. We deal with a variety of ways that those three things present, but it's like building a house. First and foremost that people think of is the plumbing system, the pipes. That's the coronary arteries and what leads to heart attacks. When those pipes become plugged, then bad things happen. So we deal with a lot of pipes in the heart. Coronary arteries, arteries in the body, all sorts of things along those lines. That is about a third of what we do. We deal with the electrical system. As in a house, you've got to have lights that come on. The electrical system is what makes your heart beat. It's the impulse that goes from one part to the other, makes the heart beat. If something's wrong with it, it can beat too fast, it can beat too slow, it can beat erratically. There are a lot of different ways the electrical system can be upset, but that's basically the other thing. And the final thing is how the structure is, the body of the house, the foundation and the walls and the roof. That's your valves. That's how the heart muscle functions. And those are two big things. But that's basically all we do is those three things. If the problem is heart related, it's going to be the plumbing's bad, the electrical's bad, or your walls are falling down. Once a person has to come to the hospital, there are things that we do that are very important, and we pride ourselves here at Lake Cumberland that we do a very good job at it. If someone has a heart attack, if they have chest pains and it's a true heart attack, then it's very important to get to us very quickly, because every minute that goes by is heart muscle cells that die, and once they die, they don't come back. They never come back. So once they're dead, they're gone. The only way to save them is to keep them from starving from lack of oxygen by opening up the artery. So people may hear that we have what's called a door to balloon time, which means by the time they hit the door to the time they get in the cath lab and we get the artery open. That's very important. We want that less than 90 minutes. We average here around 45 minutes. We have done it as fast as 9 minutes. So we've got our system down pretty well, but really that's kind of the worst case scenario. The rest of it is, if you have chest pain, we want to get it before there's damage to the heart. We don't want the walls falling down. We want to repair the plumbing and make sure that the house is still sound. So we will do some testing, some stress test, which sometimes involves nuclear imaging, radioactive imaging, sometimes not. We'll do an echocardiogram, which shows us what that house structure looks like, what the walls look like and the valves look like. And those are two fundamental tests that give us about 90% of everything we need to know to go forward or not worry about it. And then finally, if there's some funny feeling palpitations that a person has, we can put a monitor on that they wear for anywhere from 1 day to 30 days, and that's looking at the electrical part. But we start our process by looking at which of those things are giving us problems, and then once those are abnormal, we proceed with the heart catheterization if we need to. That's the way that we look at the arteries and a little bit of the structure. And during that, we do more than that. We measure pressures and we're looking at the function of certain things. But the most common thing that people are going to understand is we're looking at the arteries to see, by filling those arteries up with X-ray dye, is there a place where the X-ray dye doesn't seem to go well? That's a blockage. And from there, we can decide if we can open it up with a balloon or a stent, usually a stent, or do they need bypass surgery, or can we treat it with medicine? There are multiple risk factors in a person's health that predetermine whether or not they're going to have a high risk of developing coronary disease. Smoking is one, genetics, family history is one, diabetes, high blood pressure, high cholesterol. Those are the standard ones of disease states that a person has. There are some blood tests that we can measure that tend to indicate that they are higher or lower risk. But there is one that is absolutely foolproof in determining if you are at very, very low risk, no matter what any of those other things are, and that's called the coronary calcium score.